Hello, Namaskar and very good evening. I am Priyanka and yes, today, of course, September month is observed as the Prostate Health Awareness Month. So on this very special day, here joining with us is Dr. Sanjay Pandav. Yes, let me just give you a short introduction about Dr. Sanjay Pandav. He's a consultant urologist who heads the Department of Urology at Kokilaben Dhirubhai Ambani Hospital in Mumbai. He's a robotic and reconstructive urologist with 24 years of experience in the subject. Yes, that's a very vast experience, guys. Dr. Pandey has been at the forefront of prostate and men's health issues and believes in awareness and key management is the key. An opportunity to connect with him today. So joining with us is Dr. Sanjay Pandav. Hello, sir. How are you doing?
Good. Thank you for having me here.
Thank you so much. It's our pleasure, sir, to have you on board. So on this special date, sir, I have a list of questions with me which I'll be asking to you. And of course, today we are observing this as an awareness month. So we want to spread the news and we have to make the society aware about what exactly are these issues about prostate. So are you okay and are you on for it?
Yes, please.
So yes, let's go ahead with the questions and let's ask all the queries and the issues what we have to Dr. Sanjay Pandav. So the first question for you, sir, is what importance does September hold in prostate health awareness for society and what would you like to answer for that?
September happens to be a prostate health awareness month. Prostate is a male gland, a gland which is hidden deep in the pelvis and the perineum, of which the society and human beings don't know much. It's an organ which is a hormone-related gland, which undergoes its change through the adolescence, through adulthood, and through a geriatric age group. So when we look at this word prostate, a lot of myths actually surround it, and we don't know much about it. Remember, you have got health days, but you never had a health month. The organ is such an important organ for men, and its span changes and its activity changes across his lifetime. So for a male, to be able to be aware of entities that go through the changes in the prostate gland is an important aspect. For us, Prostate Health Awareness Month as a urologist in the whole country is important to reach the society. And from a wonderful platform that you created today, I think it behoves that we make people aware about prostate health is an important aspect of the entire health. When you look at health of various organ systems that you're aware of, the entire month of September holds a huge importance on various aspects of prostate, prostatism, and prostate-related diseases to keeping them in check. And unless we reach the society through such platforms, make them aware of the changes which are gradually happening in a graceful aging that men go through, we will miss out on those aspects and may continue to have things which could be delayed presentations. So in today's life, in September, we are looking forward to reaching the society through these platforms, making people aware that prostate which undergoes a change needs to be informed to the society. All men who matter today are in their 40s, 50s to their 80s and 90s. Prostate changes are seen in that decades of life, where from 40s to 50s and beyond, silently and gracefully, without your knowledge and without your idea, changes are happening in the prostate. And therefore, prostate health awareness in men's health, huge importance to take it forward to the next level.
Wow, so I must say this is a beautiful insight and this great drive which we have created. I'm sure each one and every one of you will get a lot of answers about your questions. So we'll continue to move ahead with our set of questions, and let me tell you, we have huge amount of questions and I'm sure all your queries and all your issues are going to get resolved. So stay tuned. So definitely, sir, I'll go ahead with the next question, and the next question is, who all should know about prostate health and why?
Wonderful. So the prostate health awareness is for everybody. It's for men primarily in their prime of life, late 40s and beyond, because that's when the prostate as a male gland is going through those hormone changes like it happens in women who undergo through the hormone changes during the menopause. So prostate health changes which happen around need to be known to every man in this country. Why so? Because prostate diseases which actually happen are gradually and very silent, and they move forward to a level where you may not be aware of. For example, the 3 prostate diseases we talk about, which men need to know, are the inflammation of the prostate called prostatitis, BPH, a common phenomena where the prostate undergoes a hormone-related change, and something of this needs to be known to every man. And there's a deviation from this change in the prime of life, in adulthood, and probably in geriatric age group, which is called as cancer prostate. So 3 different kind of entities which can actually hit the prostate could actually be helped by taking forward the awareness to the highest level. Our understanding that who needs to know about prostate over this entire awareness month of September, every man in this country needs to know about his prostate. In other words, prostate health matters. If we know about it much better and much in a better way than we never knew about, we'll be able to take it forward to the next level. The awareness is such that each man in his prime of life will go through changes. And the changes are very silent and very clandestine. And it's deep inside the body. Imagine there are organs which are visible to you like your fingers, like your face, which you can see and feel and probably know about. Prostate is not visible to you. Prostate is an organ quite deep-seated, an organ which is as small as a walnut, 10 to 15 grams, and it occupies a very pivotal position. It occupies a position where it's just below the urinary bladder of a male. So it controls the urinary passage like a government. It controls the urinary passage, and its changes bring about changes in the urinary aspect. And therefore, knowledge of every man about his prostate, prostate health, and the changes that could be happening to him will help us out to take it to the level that we aim today.
Absolutely fantastically said, sir. And yes, all age groups and everybody and all the main community should understand about this prostate thing. So we'll go ahead with a set of questions. So I have third question for you, sir. And the third question is, are prostate cancer and BPH same? I'm sure sir just spoke about BPH, but we'll get some more insights about BPH. So yes, are these things same?
Wonderful question. So prostate is undergoing a hormone change, and in that change, as gradually we touch from 40s to 50s and beyond, the two different diseases which can happen are BPH and prostate cancer. So therefore, prostate cancer and BPH are not same.
Okay.
BPH is a benign disease or a non-cancerous disease compared to a cancer prostate, which is a cancerous or a tumorous condition. So let's just open it up for you. BPH is a benign prostatic hyperplasia, a change that is happening as a result of hormone changes. What is picked up in that is either the patient's complaints or an incidental finding of changes. BPH is all about the evolution of the prostate from a small adolescent gland to a gland which has undergone a hormonal change. The word hyperplasia is enlargement of the gland as a result of more number of cells increasing. So the testosterone changes which happen within the prostate brings about changes in the prostate that could give you a health issue. So that health issue during your graceful aging is about BPH. And in BPH, men complain. Men complain about decreased urinary flow, able to not empty the bladder completely, therefore incomplete evacuation, need to strain to pass urine sometimes because the flow is gradually going low. They need to get up multiple times at night to pass urine. They don't think that they have evacuated the bladder completely. And this straining mechanism only becomes bad to worse as time goes by. And this time is not measured in days, months or years. It is over decades that the change happens very gradually. So BPH is a male phenomena which could happen to people from as early as 40s, 50s to their 60s and 70s. In today's health checkup era, the prostatic enlargement is picked up by sonography. And a man across the table gets worried about the prostatic enlargement. So enlarged or not enlarged, the prostate can actually occlude the urinary passage. As I said, prostate actually governs the urinary passage. So if the urinary passage is gradually getting narrower, the urinary flow may go down, and he could be suffering from symptoms of prostatism or BPH. While the hormone changes are happening, a subset of patients may go in a different direction, which could change towards cancer prostate. So cancer prostate is a cancerous change which has happened in the background of hormone-related changes in a hormone-related gland, which is a male gland, compared to BPH, which is a benign change which men will go through. I'm sure nobody will escape it. All men will go through some degree of change in their prostate. It therefore behoves that in a Prostate Health Awareness Month, let's get to know about our own prostate health, which is best known by understanding that, do I have any complaints? If I have a complaint, I see my urologist and pick it up. So BPH and cancer prostate are two distinct diseases. They could be probably there together. And that's where we'll come to if there are any questions on that.
Absolutely. So now this leads me to intend to ask you the next question, and that is, what age group of males do you think are at risk of prostate issues and prostate cancer, and who are likely to suffer this disease?
Wonderful. Yeah. So nice. So the age group of men who suffer from prostate issues is vast. It starts in the mature years, even 40s to 50s, and it could be a suffering in the 70s, 80s, 90s, and even when they make a century. In other words, prostatitis or inflammation of the prostate, which could happen as a result of an infection within the prostate, either acute setup or sudden onset setup where there is burning, pain, discomfort, unable to pass urine, compared to chronic situation called chronic prostatitis, is more of a disease of younger men. So youngsters in their 40s to 50s could get prostatitis or prostate-related inflammations, which could be related to an infection-related condition. But we are talking about BPH or prostate change as a result of hormone aspects, and the urinary passage is gradually getting compromised. Remember, God gave a urinary passage which is as narrow as you know, and that narrow passage is governed by a gland which actually surrounds the prostate. As prostate undergoes change, the prostate could occlude the urinary passage very gradually. As I said, it happens over years or decades. So the men who suffer from prostatism or prostate-related changes are in the late 40s, 50s. It could be in the 60s, 70s, and 80s as the changes happen. And these changes are progressive and very silent. Obviously, there are complaints which people pick up earlier and they go and see their urologist. So age group of people who suffer from prostate changes could be as early as 40s, 50s to as late as 80s, 90s. A lot depends on how you adjusted to a problem. And if you adjusted to it, you continue to adjust and possibly did not complain. And when you complain, it sometimes can be too late. So your adjustment to life and adjustment to various changes, as it happens that you adjust yourself from black hairs to grey hair very gradually. You don't complain about it. Similarly, your urinary flow is gradually changing. And unless you complain about it, unless you take a notice of it, unless it becomes too bothersome, sometimes it may be late. And therefore, men need to realize that prostate changes are innate. They're going to happen to everybody. Somebody less, somebody more. Somebody in their 40s, 50s, and somebody in their 70s and 80s.
Okay. So we need to keep a track of our health.
Absolutely.
I think every man should keep a track of their health. As Sir said, there's no particular age group for it, but of course we need to keep a track of our health. Right. And I think, likely said, everybody needs to do the same. Which brings me to the next question, sir. So since you have given more insight about this prostate cancer, I want to ask you, is prostate cancer scary, or is it a deadly disease, or have we found any remedies towards it?
That's a great question. Prostate cancer, remember in 1947 when we became independent, the lifespan of an Indian male was 47 years. Sitting in 2021, the year of pandemic, our lifestyle has changed and expectancy has gone to 71 years. And in 10 years time, we will touch the Western countries at 80 years, which means that prostate cancer was not much known to us because we never survived so long. And those who presented in that era, when the medical health care was on a lower level, presented with an advanced disease. Sure. Sitting in 2021 on an awareness drive to such a strong platform, I need to make you aware that prostate cancer is not a scary disease. It is inevitable that if it has to happen, it can be picked up a little early. So the good news about the positive prostate health awareness today on this platform is we can pick up prostate cancer much earlier. What is going to happen tomorrow is going to happen. But if we can pick it up earlier, then we possibly may be able to treat. And why treat? We could cure it completely. So that aspect of picking up a disease early makes it all the more positive that we will be treated if it comes. In other words, prostate cancer is a hormone-related cancer compared to other cancers you have. Okay. You have got lung cancer, you've got a stomach cancer, you've got urinary bladder cancer and kidney cancer. These are not hormone-related tumors. A hormone-related tumor or a prostate cancer, which is an adenocarcinoma, can be actually manipulated and treated in an early stage or even in advanced stage. Our yesteryears or yesterdecades in the country are more of advanced stage presentations where we could manipulate the hormones. We could look at various things we could bring about by radiotherapy, by hormone manipulation and treat them. But in today's world, I must tell that prostate cancer is not scary because urologists are interested in you. They're interested to reach out to the society through such platforms and make you aware that prostate cancer can be picked up very early provided you take that first important step. And that step is about identifying yourself. As she rightly said, that if you identify yourself in your urinary complaints, if you are somebody who does your health checkup yearly, you probably pick up things earlier. Prostate cancer can be picked up earlier than other cancers by a screening mechanism. And therefore, men beyond 50s are always requested to become a friend of a urologist. In other words, you have a friend urologist who is keen to look at your complaints and your evaluation. He picks up your PSA, a blood test. He examines you by a digital rectal examination. He looks at your sonography and he looks at your complaints. And doing all that, he assimilates and puts up a picture where he knows whether you're suffering from a BPH or possibly there's a suspicion of prostate cancer. Pick it up early and localize and treats you. So why scare at all? And therefore, the entire month of September is being spread towards a prostate health awareness. If you're aware about yourself, I'm sure you will do better than what you've done in the past.
So there you go, guys. It's not a deadly disease at all. This answers your question. And Dr. Sanjay Pandav, all the way up to you. So you can reach him whenever you want. Thank you so much, sir, for these insights, which bring me to the next question. As I said, guys, I have this list of questions with me. And yes, so of course, as I said, all the questions and you have got multiple answers, guys. So yes, this is not yet over. We have the list of questions with us, and let's catch up more insights towards prostate cancer, because September month is observed as the Prostate Health Awareness Month. So which brings me to the next question, sir. And you have to highlight more. You have to tell the audience or our community more about the myths about prostate that you would like to dispel towards audience, to our society.
Wonderful question. So prostate is an organ of men, and it gradually undergoes changes with hormones. Remember, prostate was a small walnut-shaped gland of 15 grams when somebody was an adolescent towards adult. But the changes which actually bring about the gradual disease processes is not known to men. Unfortunately, there are many myths which rule the prostate issues. For example, let's go to the first one. People feel that the prostate diseases always happen to elderly, to our forefathers and grandfathers. That's not true. I would always suggest that we need to be aware about prostate health, because it can afflict youngsters in the graceful aging from their 40s, 50s, and obviously in the prime of life in the 60s, 70s, and 80s. So, prostate diseases don't always affect the elderly, number one. Number two, people feel that PSA is not required as an evaluation, or PSA can be done every month. Both of them may be wrong. PSA, or prostate specific antigen, is a product of the prostate. It's produced by the prostate, and it is therefore measured in blood. So it's a blood test which is done early morning, fasting state perhaps. If you do that test, if we get to know about your prostate level production of the PSA, which is anything between 0 to 4 nanogram per cent. If somebody feels that they need to do PSA every month, it's wrong. If somebody feels that PSA is not required to be done, also could be wrong, because PSA is an organ-specific marker. It is not a cancer-specific marker. In other words, PSA can rise to very high levels even in acute infection. So all rise in PSA is not cancer, please. That's very, very important. So that's the important myth that PSA is a prostate cancer marker. It's not true. It is one of the markers which we corroborate. Your language, the health checkup, digital rectal examination and evaluation helps us out. So that's one. Number three is, people always think that the prostate is something which is not grown and therefore it's not a trouble. Prostate is not visible to you. It is not a scrotum, it's not a finger, it's not a genital. It is deep inside the pelvis and the perineum. So if you can't feel, then it not necessarily is an organ to be felt. A urologist is qualified that his index finger can actually feel the prostate through a digital rectal examination. He can pick up the evaluation and can bring about a suspicion. So it's important for us to know that the prostate cannot be felt by us on our own self. Number three. Number four, very important, is that prostate doesn't undergo through only one disease. It can go through prostatitis, it can go through a BPH, and it can go through a cancer prostate. All prostate enlargement is not a cancer prostate. Now some people feel that if you have a prostate surgery done, then your prostate is always removed. So that's a myth. When we do a surgery or a surgical cure for a BPH or a prostatic enlargement or a prostatic occlusion, we only remove the internal part of the gland or the enlarged part of the gland, which is occluding the urinary passage, and we leave the outer shell. So it's very important for you to know that the myth is that the entire prostate is removed. Not true. The prostate is entirely removed when I do a robotic removal of the prostate for prostate cancer. For a prostate cancer, the entire prostate is removed, but when it comes as BPH, the internal adenoma or the obstructive part of the gland is removed. So these are the myths which people never knew. Finally, even if you have undergone a prostate surgery by a urologist in your city, you need to continue seeing him, because the outer shell can still let the prostate grow. As your hairs continue to grow while you keep getting hair trimmed every month, the prostate can grow because of the hormones, and sometimes the prostate cancer can come up because the outer rim or the peripheral part is from where the prostate cancer normally arises. So in other words, these are all prostatic myths which people don't know. They think that once done, it's cured forever. Once done is cured forever for sure, but a follow-up is something which is very important. So therefore, be friends to a urologist who has treated you.
Absolutely wonderfully said, sir. And as Dr. Sanjay Pandav already said, he is always available for you guys. So do not forget to always ask him the queries. Which brings me to the next question. Since sir have given so much of insights about prostate cancer, I would definitely like to ask him, sir, this is the question. So what is your actual involvement in prostate diseases?
A wonderful question. That I carry that passion to make people aware, and therefore we are here on this important Prostate Health Awareness Month. The first involvement is to reach the society and reach every male and make them aware that your prostate health is important. As a specialist on urological subjects and in prostate issues, we look at men's complaints and pick up things earlier than they pick up. As I said, graceful aging is about adjustment, and as we adjust, sometimes health hazards can happen. One of them could be a prostatic enlargement, occlusion, obstruction, and finally a retention of urine or blockage of urine. So would you wait for an emergency to happen, or would you pick up early? And that's where my involvement in prostate diseases is in everything: acute prostatitis, prostatic abscess, prostate enlargement, health checkups of prostate issues which men come up with, and finally the prostate queries, finally treating prostate cancer. So that I look forward to this awareness drive. I look forward to people understanding that they've got urinary issues related to prostate. If that is so, on one side I'm involved with medical treatment of prostate diseases, which is BPH, which can be medically manipulated today, that we have got the wonderful medicines as a result of research that we have in the country. On the other side, we pick up early prostate cancers as localized diseases and treat them and finally cure them. So my involvement in prostate diseases is about awareness, is about identifying your complaints earlier than you make it, because till the day you continue waiting, it could be probably late. And finally, at the end of it, you need to treat people, and that treatment is involved in terms of doing a BPH therapy or a cancer prostate therapy. A BPH therapy is all about medical management, or doing a TURP or a laser prostatectomy. On the other side, we now do more and more of robotic cancer prostate surgical removal called robotic radical prostatectomy, which is a cure for cancer prostate. So I'm deeply, thoroughly immersed in prostate diseases of men, and I continue to do that in terms of awareness, therapy, and cure.
Absolutely wonderfully said, sir. And yes, which brings me back to tell you all, yes, the awareness is very, very important, and prostate cancer awareness is the need of the hour, guys. So yes, keep a check on your health track. And here we are to ask some more wonderful questions and which can get insights about the prostate cancer today. And I have the next question with me, and the question is, so what do you think, sir, are the treatments available for BPH?
So wonderful question. Just taking forward to that aspect of treatment which a modern urologist does today for you. He has got all those medicines which could actually help you come out of that agony of obstruction to the flow of urine or not able to control urine. Remember, prostate is undergoing a gradual change in occluding the urinary passage. And when you complain about your obstruction to the flow of urine in your 50s, 60s, 70s and 80s, your urologist would look at the medical aspect of it, which means he can score you by the kind of symptom scores that you have. He can identify your aspects on the prostatism, and I and our urology colleagues in the country give you medical management. So two medical managements that we do very frequently together is improving the flow of urine with various alpha blockers therapies available in the last 20 years, which with research has only got better and better. On the other side, we also look at why do you gracefully age and your ear catches up, we can actually get your prostate younger. And how do you do that? Your prostate is gradually increasing in size, and today we have these 5 ARI inhibitors which actually work on the internal environment of the prostate and shrink the prostate. So what do? We do a combination therapy in men with enlarged prostates, where we in one term improve their flow, and they feel good about the flow. They feel that the flow has got better, they feel younger about the flow, they empty their bladder better. On the other side, I give them medicines of the 5 ARI inhibitors, which are 2 in number, and they can shrink the prostate. So combination therapy of this is a very common therapy we give to our fathers and grandfathers in the country that I continue to do. On the other aspect, for the BPH, on patients who are refractory to medical treatment, the medical treatment does not work, we attempt to change, we attempt to evaluate them and understand why is medical therapy not working. Are they beyond the medical management? Because BPH actually is a surgical disease. There's an occlusion or obstruction. You got to remove the obstruction. And for that, today we are spoiled for choice with wonderful medicines available, where we are able to deviate the natural history of the disease with medical therapy, which almost means that you take medicines for long. Sometimes you take for life or you take for decades. We reverse you and we continue evaluating you. But on the other side, if you are refractory, if there's too much of obstruction, or you go into retention or a complication, which means obstruction completely, or you have got bleeding in urine as a result of prostatism, you form bladder stones as a result of the stagnation to the flow, which is not happening well, then we land up with surgery. And that's where I'm involved in TURP, the gold standard, where telescopically we clear the prostate internally and leave the outer shell to evaluate you year after year again and look at changes don't happen again to this level. We also do laser prostatectomy by a holmium laser or a green light laser, and you finally complete a therapy which to you was always a trouble that was not medically being managed. So either I treat medically or treat surgically. A lot depends on the symptom score, the bothersomeness, and the stage of the disease which a patient presents to.
Okay. Very well said, sir. So as you said, sir, these are the treatments which are available for BPH. And at the first instant, you said BPH and prostate cancer are two different things, right? So the next question, which brings me to the next question. And the next question is, so what do you think are the modern treatment which are available on cancer prostate that you yourself impart to your patients?
Wonderful. Prostate cancer today can be picked up localized and early. So gone are those decades where we picked up advanced diseases and spread diseases. We can pick it up early. And therefore, on a health awareness of September month, we're looking forward to people understanding that I could only treat somebody who could come with complaints or come with disease. And therefore, the passion to treat and the passion to cure depends completely on what kind of diseases they pick up. So in a localized prostate cancer, which we pick up by a prostate screening, where men from this platform pick up and understand their urinary health and prostate health, go through a health checkup or go through a urological checkup where they get a PSA test done, where they get a digital rectal examination done. They go through the screening and evaluation, which gives us an idea that this is not a BPH, but this is a cancer prostate. Picked up incidentally or picked up as a result of changes which a man was having. Remember, prostate cancer does not come with very difficult or different symptoms. They come intermingled with a BPH kind of symptoms or maybe asymptomatic. Therefore, I treat patients today on prostate cancer by the modern therapy in a localized prostate cancer by robotic radical prostatectomy. Try to understand that this is one of the biggest revolutions in today's world where robotically we are able to do something which we could not do in the past. Men have got a different kind of a pelvis called an android pelvis, which is a V-shaped pelvis. At the bottom of it, deep inside is the prostate. So prostate is hidden quite deep inside. There was an era when we used to do open surgery, which we continue to do in the world over. But as we revolutionized on technology and understood, we could reach the depth of the V with this amazing kind of Da Vinci robot that we have today at the Kokilaben Hospital, that we own the SI and the XI, the most modern of the robots. We are able to actually do a localized cancer prostate removal completely, almost bloodless, keeping them continent and keeping them on their erectile function as good as they were. So what have we achieved? We achieved a man who's as good as he was, and the cancer prostate was detected as a localized disease, an early disease, and we could cure them. I do that for the last 6 years robotically. Before that, I was doing an open surgery. Therefore, robotic surgery today has actually underscored the need for us to identify people early because we can treat them localized. We can keep them away from those complications of yesteryears where incontinence was a big issue. The precise treatment that I do on prostate cancer today at Kokilaben Dhirubhai Ambani Hospital is a lot related to the teamwork that we have in terms of the evaluations, the kind of nuclear medicine setup, the kind of pathological setup, and all those allow me to probably pick up things early. And therefore, the ball is completely in your court. Let me treat you much earlier than it could actually be picked up. Only by you identifying yourself that you are in your 50s, 60s, and 70s. You could have a prostate cancer, touch wood, nobody should have it. But if you have one, we pick it up early by an evaluation, we pick up early by your complaints or by a health checkup. And once that is done, the localized prostate cancer today is curable completely by a robotic radical prostatectomy by an efficient and a precise way. And that's what I continue to do for last few decades.
Wow, that's a huge contribution to mankind, guys. And sir, I would like to ask you, like youngsters and everybody have a notion that they are not at risk, which brings me to ask you the next question, and which is, who do you think are at risk for BPH and cancer patients?
Okay, so if we again divide the subject into BPH, the benign disease or the non-cancerous disease, every male beyond 40s, 50s is at risk of prostate change because his hormones are changing. Like women go through the hormone changes and finally land up at menopause. Men don't have a menopause. Men don't have 1 day, 1 week or 1 month of change. A gradual change in testosterone with the hormone changes happening down in the prostate could lead to those changes of BPH. So BPH could make you symptomatic where you have got urinary complaints. It could be everything. It could be as young. So it's not about the age, as I said. So people who are at risk are all those who are in their 50s, 60s and 70s. They know that they have got urinary complaints. They would not continue eating medications if they don't get benefited. They would not continue sitting in their homes and continue to have difficulty in passing urine, not able to pass urine, passing frequently, leaking urine and getting up multiple times at night. It's nice to see your urologist for complaints that are already there. For people who are at risk for cancer prostate are men who actually have got their first degree relatives with cancer prostate. That means if somebody's elder brother or somebody's father had a cancer prostate, then the younger one needs to be screened more frequently than others.
Okay.
They are at risk towards cancer prostate. But as I said, that cancer prostate is the 4th commonest male cancer beyond 45 years of age in India. and the commonest male cancer beyond 45 years in the Western countries. So it's not that we are catching up, but this disease is being picked up earlier. This disease is being picked up by multiple modes and mechanisms, more so by your health checkup, more so by your complaints, more so by you and your urologist discussing it across the table. So identifying it earlier is always important. So risk factors are there, but there are no major risk factors like the other diseases where you have got smoking as a risk factor, etc. Being a male with prostate, hormones will change and you will have prostate at risk.
There you go, guys, which answers most of our questions. And yes, so always keep it in mind, no self-medication. Always seek a doctor when you're at trouble. And yes, which brings me to the end of the session, and we'll pull the curtain down for today's event with today's list of questions. But yes, before going, I have this very important question, and Dr. Sanjay Pandav is going to highlight about it. And which is, of course, he has been actively participated in many of these health social events. So let's hear from him. So I would like to ask you, sir, so you're totally active on awareness on each and every health aspects of your life. But today in Prostate Cancer Awareness Month, what will be your message to the society, to the mankind? Because you have already contributed in a so wider way for this mankind. So I would like to ask you today this message for you, for the society on this Prostate Cancer Awareness Month.
Thank you so much. So prostate health is an important health we are all aware of because we celebrate the entire month of September towards prostate health awareness. As I said, we have got health days like a World Kidney Day and World No Smoking Day. We've only got days to make you aware. But imagine the entire month being dedicated to prostate health awareness is obviously a big issue. It's a big issue because, as I said, the prostate health changes are very silent and gradual. Men suffer from it and men sometimes postpone health. In 2021, the motto should be, health should be brought to the front row seat. You cannot postpone health. So if you have complaints on the urinary aspects, which includes obstruction to the flow of urine does not come with the speed that it was in the past. You could paint on the walls, you can't do it anymore because you're gracefully aging, because your stream is getting narrower, because you have to strain and push urine out every time you go to a public toilet, you take longer time than the others, you don't empty your bladder completely. If those are your complaints, then don't sit home. After you heard this, go and see your urologist in your city. At Kokilaben Hospital, I and my team of colleagues look at this prostate health with a lot of understanding. Attempting to reach you into the society is with a deep notion that we'll be able to make you aware of something which has been postponed in the past. Postponing health of any aspect is not acceptable. And when we look at prostate health, because it's a very silent progression, you may not know much about it. So prostate health is something which is very close to my heart as a result of the years of work that we have done. So in this passion to promote positive prostate health awareness in September, we're looking forward to men knowing about it. And the awareness can be best done by these kind of platforms today. We continue to do that the entire September every year. But in 2021, when we are beating the pandemic so well, we need to beat health hazards too. And therefore, be aware of your prostate. Prostate will undergo a change in everybody. Nobody will escape it. It's possible that we may pick it up very late as a complication of prostatism, or you pick it up very early. If you look at yourself and do health checkups and identify things early, your urologist is going to look at your PSA, you're going to look at your ultrasound images, you're going to look at a digital rectal examination, and he will ask you to do a uroflowmetry. In other words, he will actually assess you completely on aspects that you may not be knowing. To pick up a prostate disease issue earlier than a complication is a need. And that's where, while we battle the prostate health issues every Monday to Saturday on more of complications, more of emergencies, the awareness today is to look at that the prostate will undergo a change. Its change can be manipulated and the entire natural history of aging can be deviated to make you younger in your flow and to shrink your prostate by the medical therapy we undertake. The medical therapies may be lifelong or maybe long-standing, but they will help you to get treated completely. So if you get cured by medical management, you possibly may not require a surgery in the future. In other words, a urologist will look at the evidence and would probably place you on a medical therapy and would take you to a direction from where he continues to monitor you more by your complaints and symptoms and by some health evaluations, which is what we need to do. PSA or prostate-specific antigen is a product of the prostate, not a cancer prostate marker, but an organ-specific marker. It can rise in other situations like prostatitis and infections, and sometimes we get scared about it. So I think the entire aspect of removing the scare from the male mind is important. Men need to know that they will age gracefully and changes will happen. We have never seen about what will happen tomorrow. So to prevent the tomorrow, I predict that we pick up our own challenges to identify ourselves first. If you have a urinary complaint, we see a urologist. If you have no urinary complaint and we are in our 50s, we do a health checkup and identify the invisibles of the PSA and the prostate size, and then we look at a uroflowmetry, a test which I call it as an ECG of the bladder. So in other words, we have got evidence today that changes are happening in everybody. Picking up very late in life and possibly having a complication is not the most desirable thing. And therefore, my message to the society is, as a man in his late 40s, 50s, if he has a urinary complaint, somebody in his 50s, 60s, 70s and 80s has a urinary complaint, should not sit home. If you are on a medical management for prostate diseases, which is BPH, and you don't get the desirable result, then you should not wait on it. The urologist is qualified to look at why did you not get the right result. He will look at a uroflowmetry, look at a urodynamics and help you to go to the next level. In other words, if medicines don't work, we need to identify why they don't work. And if medicines don't work and you land up with unfortunate emergencies of blockage of urine, slow streaming down, then we need to look into the next level of evaluation and possibly identify you earlier rather than an emergency to treat you surgically. As I said, BPH is a surgical disease which today, by a medical management, we have deviated the natural history. So if surgery has to happen, it has to happen for a cure. And if that has to happen, we do it quite regularly. On the prostate cancer side, as I said, as we live longer than our forefathers, we will be having more and more men in a higher lifespan expectancy. When we see them, we will look at them having prostate changes. We can pick up things early in a health checkup or through their complaints. In today's world, we are better off than yesterday because we have got technology and we have got teamwork, which was never there. A teamwork of identifying with our colleagues in general practice, our colleagues in the society as men who pick up things early and go and complain to their doctors. In today's era of telemedicine, where you can reach a doctor in any city, why wait at all? If you have a doubt in your prostate health, if you have doubt in your urinary complaints, it's identifiable to pick up things in time, and when we do that, a localized prostate cancer is almost curable. It's curable to the core, whereby a robotic radical prostatectomy, I continue to do few patients every week from the region of a disease which has been picked up, and a diagnosis of that scary kind which was always a worrisome, to complete therapy and cure, the way I continue to do better and better with every year. So the message to society today is, be aware of your health, like you take care of various aspects of your health. An invisible organ is gradually, gracefully changing. It's changing over decades and very slowly. If you have identified yourself as a man with prostate issues, then you probably happen to be an ambassador of this disease to everybody in the country. You will spread the message of positivity to make more people aware that prostate changes can be picked up in time by the patient and by your doctor. Your doctor who is involved in doing this is a urologist, and all urologists in the country who are our colleagues take part in prostate disease awareness, prostate healthcare and prostate treatment. So don't waste your time. Bringing healthcare and prostate diseases to the forefront of healthcare in 2021 is the motto. With that, I leave you and hope that more and more people will take this challenge of identifying themselves much earlier. Thank you so much.
Yes, that's a beautiful insights provided by Dr. Sanjay Pandav, and yes, which brings me back to the proverb, जो भगवान नहीं कर सकते वो डॉक्टर कर सकते हैं. So take care guys and be aware of your health issues. Always seek a doctor in emergencies, and of course if you identify something is wrong with you. So guys, no self-medication this time. So this is the Prostate Cancer Awareness Month, and we had Dr. Sanjay Pandav with us. So thank you so much for joining us, sir, on board, and thank you so much for providing this beautiful insights about prostate cancer. Thank you so much.
Thank you. So they always said, you do your best and God will do the rest. Out here in prostate health awareness, you do your best and your urologist will do the rest. Take it forward.
Very well said.
Thank you.
Thank you so much.